Hello, everyone, and thank you for checking us out. This is SAC Health Answers, a program where we answer your questions about health. I'm Dr. Jason Lohr. Many of you may know me here as the CEO of SAC Health, but I'm also a practicing family medicine physician. And today we have a question that actually comes from Anonymous. And this question is related to mental health. It says, I often feel stressed and anxious, especially before big events or deadlines. How do I know when normal anxiety crosses the line and becomes a problem? A time when I should stop managing it myself and really seek professional help. Well, this is a great question because there's still a lot of stigma when it comes to mental health, and people still have a lot of fear and a lot of even anxiety asking questions about mental health, especially when it comes to stress and anxiety, which we all experience at any given time in our lives. Let's focus on this because there is a difference between maybe what could be a little bit of anxiety or a little bit of stress versus when it's becoming overwhelming and it's really impacting life. And so there's really 4 areas that we look at when we're deciding if this is something that a patient will need help on when it comes to their anxiety and their stress. The first question would be, is this something that's just happening for, a few minutes every month, or is this something that's been consistent and persistent, happening on a daily basis over weeks or even months, even up to 6 months? That's very, very important because the timing is really critical to know how impactful it is for the person. The second question is it impacting your life? I had a professor in med school who said when mental health diagnoses were coming up, he said, it's not a problem unless it's a problem. And I always wondered, what does that mean? It's not a problem unless it's a problem. Well, the issue was, is it impacting your daily life? Is the problem that you're having impacting your ability to function, either at work or at home or at school? If you're not able to meet deadlines at work, if you're not able to turn in homework at school, if you're not able to connect with family or friends socially, then that stress or anxiety is impacting your life. It is keeping you from actually functioning and doing the things that you need to do on a day-to-day basis. The third thing that is very important is physical symptoms. Is the anxiety, is the stress manifesting in maybe other ways of physical symptoms? It's very, very common when we're dealing with things in the brain that it can impact even the way that our body feels in other areas. Some people will have panic attacks. And in those panic attacks, it'll feel like the heart is racing. It feels like you're sweating. You're having a lot of nervousness, and you're feeling that in the rest of the body. If that is happening and that's becoming a consistent, real thing on a regular basis, then we need to know about it. Your primary care physician needs to know about it. Last thing is, are you relying on something else to cope with this anxiety or this stress? And so some of those coping mechanisms that can be negative coping mechanisms would include maybe alcohol or drugs. Are you searching for some other treatment that is not an appropriate treatment, but a treatment nonetheless in order to help with that anxiety or with that stress? You see, these 4 areas are what we look at in order to decide whether or not it is severe enough for a treatment plan, whether you need to speak to a therapist or see a therapist, or whether we need to actually add medication. So it's very, very critical for us to understand the severity and understand how it's impacting your life in all of these different realms and areas. Thank you for that question. Very, very important one, and one that many people are just hesitant to ask just because of the stigma that still surrounds mental health, but so important because I will tell you, everyone is dealing with stress or anxiety on a regular basis, and it really is critical for us to differentiate between what is normal stress and anxiety and what is really impacting life that you will need to see a primary care physician for. Remember, your primary care doctor is your partner in health, so always connect with them for any questions you may have regarding your health. Thank you for joining us, and hope you join us for next episode.